All right, health students, we are going to run you through the physical fitness presentation quickly here. So, physical fitness is to the human body what fine tuning is to an engine. So, if you think about what fine tuning an engine entails, it entails changing the oil, checking the tires, checking the pressure, checking the fluids. So, physical fitness does the same thing to the body. It helps it run more efficiently, just like fine tuning an engine helps make a vehicle run more efficiently with gas mileage, making it last longer. So, when you think about it, the two are quite similar. This graph just shows where the US ranks as far as obesity. So, we discussed body mass index when we did our body comp lab, and the percentage of population older than 15 years old with a body mass index greater than 30 was represented in this chart. And as you see, the US is represented with a much higher percent than any other country illustrated. So physical fitness, in definition, is the ability to perform your daily tasks with energy left over for enjoying other activities without being tired, sore, or out of breath. Meaning that you can go to school, you can go to some kind of physical activity after school, you can do your homework, and then have energy left over to do other things that you enjoy. So benefits of physical fitness to a teenager, as you see, are weight maintenance, loss, so maintaining your weight, losing weight, gaining muscular strength, making your heart stronger, increasing bone mass through weight-bearing activities, which we talked about, um, managing your blood pressure. Hypertensive means high blood pressure, and there are teens and youth who have high blood pressure already. Managing your anxiety and stress, and achieving a higher self-esteem. Your body naturally releases endorphins into your blood, which increase your levels of happiness as well as make you feel better about yourself. Some physical benefits: increased efficiency of the lungs, reduces cholesterol, which builds up in your arteries like we've discussed. Increase your muscle strength, increase bone density, reduce blood pressure, and reduce risk of major illnesses such as diabetes and heart disease. Mental benefits: you just feel better about yourself. You have more energy. So when you feel kind of sluggish, you feel like you don't have energy, exercising will actually give you more energy. You'll sleep better, you'll cope better with stress, and you'll have better mental acuity, which means your better ability to focus throughout the day. Some national obesity statistics: 2/3 of Americans are overweight. There's been a 50% increase in obesity than 20 years ago. 50% of Americans are considered obese, so that's a body mass index of over 30, and 5% morbidly obese, meaning that they're so overweight that premature death is going to happen. In 1969, 80% of students spent time playing sports every day. Now, current data shows that 20% spend time playing sports every day. So as you see, there is cause for great alarm with where we are obesity-wise. The average 17-year-old will spend 38% more time in front of the TV than at school. And your generation is the first generation of kids with shorter lifespans. For the first time in 100 years, you will have a shorter lifespan than your parents. So we need to ask our questions: why such high numbers for the following risk factors? Why are so many people getting heart disease, high blood pressure, diabetes, suffering from obesity-related diseases younger and younger? So pause the video and think about why this may be. Truly, a sedentary lifestyle and what we put into our bodies are the major causes for these risk factors. So the 5 components of fitness: cardiorespiratory endurance, muscular strength, muscular endurance, flexibility, and body composition. Cardiorespiratory endurance is the ability of your heart and lungs to efficiently distribute nutrients and oxygens to cells and remove waste. So the more efficiently your heart and lungs function and how quickly they recover are good indicators of cardiorespiratory endurance. To improve your cardio, you need to do activities that keep your heart rate elevated at a safe level for a long time, such as walking, swimming, or bicycling. The activity you choose does not have to be strenuous, but it needs to be something that changes as you change. As you become more fit, the activity needs to become more challenging. Aerobic versus anaerobic. Aerobic exercise is something that is nonstop, repetitive, strenuous physical activity that raises the heart rate and breathing. It should last at least 20 minutes. 30 to 60 is recommended. For teens, 60 minutes a day is recommended. Some things you can do: bicycling, running, swimming, dancing, jogging, skateboarding, anything that increases your heart rate. Um, Anaerobic exercise is exercise that's short, quick bursts of speeds, usually lasting only 30 seconds to a few minutes. So sprinting, weightlifting, um, a basketball game with lots of fast breaks would be considered anaerobic exercises where there's lots of starting and stopping. The difference in each is that in oxygen, the muscles can't supply enough oxygen to the cells um, during anaerobic activity versus aerobic activity. The pace is slow enough that the oxygen supply can keep up with the muscles. Muscular strength is the ability of a muscle or muscle group to exert a force, a maximum force. So push-ups, bench press, pull-ups, squat can all measure muscular strength. How do you improve it? The key to making your muscles stronger is working them against resistance. So using weights or gravity, your body weight, to perform exercises. Muscular endurance, the ability of a muscle or muscle group to complete continuous contractions without fatigue. So that's your ability of your muscles to do something over and over and over without getting tired. Curl-ups are often used to test endurance of the abs. So how do you improve your muscular endurance? Try cardiorespiratory activities such as jogging, walking, biking, dancing, and any body weight training exercises, yoga, Pilates, pretty much anything you do where your muscles are contracting over and over is muscular endurance. So what's your goal? If your goal is to get stronger, you're going to focus on strength, which is higher weight and lower reps. If your goal is to gain endurance, you're going to want to do lower weight and higher reps when you exercise. Different types of lifting. Isotonic means that the muscles contract and relax through a full range of motion. Isometric, the muscles contract, but there's no movement at the joint. Isokinetic is moving a muscle through a range of motion against a resistance that changes. There's special equipment that is needed, mostly used in a rehab setting. Flexibility is another component of fitness where the joints are able to move through a full range of motion. The sit and reach is a good test of flexibility. So how do you improve your flexibility? You need to incorporate flexibility every day. So 10 to 15 minutes every day to improve your flexibility. And body composition lastly is the makeup of the body in terms of lean mass, muscle, bone, vital organ tissue, and organs versus fat mass. So an optimal ratio of fat to lean mass is an indication of fitness. So how much lean mass you have compared to how much fat mass you have. So how do you improve your body composition? Exercise. Eating right, exercising. The Batham scale is a quick thing to do, but it doesn't necessarily give you accurate information, because when you exercise, you gain muscle, which weighs more than fat. So actually, body composition is truly the best way to measure your fitness level as far as losing weight, gaining weight. You need some fat for nerve function, protecting the bones and joints. Bones and muscles provide energy and help your body adjust to heat and cold. So how do you know it? In class, the amount of body fat, adipose tissue, is a better measurement of health than scale weight. This can be tested by underwater weighing, skin fold measurements, which we'll do in class, bioelectrical impedance, which we'll do in class, and then BMI. So there's a picture of underwater weighing, the bod pod, and the skin caliper method. And there's bioelectrical impedance. The FIT principle is frequency, intensity, time, and type. Frequency is how often a week do you exercise. Intensity is how hard you exercise, measured by how much weight you lift or how hard your heart's working, which is through heartbeat. Time, how long you exercise. And type, what kind of activities are you doing, as well as what components of fitness are you incorporating. Frequency, number of times you exercise in a week. What's recommended, at least 60 minutes for teens, as seen here. And the lower the intensity, the longer you need to spend, versus the higher the intensity, the less time you need to spend. So the more vigorous your workout, the less time you need to spend to achieve the same results. Target heart rate, 220 minus your age is your maximum heart rate. You take your maximum heart rate times 80% or 90%, and you take your maximum heart rate again, 60% or 70%, depending on where you want your range to be. You can be higher or lower. And this is your healthy training range. So if you're 15 years old, your training range is 185 beats per minute to 144 beats per minute. Here's target heart rate for someone who's 26. As you see, that range is going to be lower the older you get. 67-year-old, 112 to 92 beats per minute. So why is it important to be aware of your target heart rate? It's important because you need to know where to change that you're not training too hard or too easy. Recovery time is the amount of time it takes your heart to return to a normal at-rest rate after exercise. So it's a good measure of the body's general fitness. So the shorter the recovery time, the quicker your heart returns to normal, the more fit you are. And here's just a way to go through so you can pause and look at how you find your recovery rate. So getting started, you need to ask yourself some questions. Do you have any health concerns? Are you healthy enough to begin a program? What types of activities do you enjoy? How much will your planned activities cost? And finally, what is your goal? So designing a fitness plan for you incorporates lots of different things. If your goal is cardio, you want to do it 3 to 5 times a week. If your goal is muscle development, getting stronger, at least 2 to 3 times a week. Exercising safe, which we talked about in class. Avoiding dehydration by drinking enough fluids. Avoid overtraining by listening to your body, getting enough rest. And obviously avoiding anabolic steroids. How can you avoid injuries? Get warmed up. Don't start too hard too fast. If you're not in shape, you don't want to go at things too hard or you're going to get injured. Stretch, avoid dehydration, overtraining, avoid overuse injuries, and choose correct equipment and clothing. Treating minor injuries: if you get hurt, rest, ice, compression, and elevation. Rest the injury, ice it for 20 minutes, take the ice off for 20 minutes, ice again for 20 minutes, do that for the first 48 hours. Compression: some injuries require you to wrap the injury to try to get the swelling out of the joint. And lastly, elevation can help. Acute versus chronic. Chronic injuries when you have a dull ache at rest and pain when performing activities. This is something that develops over a long period of time, where acute injuries are sudden severe pain, swelling, inability to place weight on a limb. Acute symptoms are a dislocation, a break, sprained ankle. Those types of things are acute. Some common chronic versus acute: sunburn would be acute. Tendon or muscle strain could be acute. Fracture, acute. Ligament sprain, acute. Heat exhaustion, acute. Concussion, acute. Tendinitis would be chronic. Stress fractures are chronic, and as well as shin splints. So for your last thing we want to discuss is your physical fitness assessment. So the first question asks: setting a goal is primarily one of the most important steps in beginning a fitness program. Set a specific goal for yourself and discuss why this goal is important to have prior to beginning your own physical fitness plan. So you need to know where you want to go. So if your goal is to run a 6-minute mile, then you need to train for that 6-minute mile. But to set a specific goal, you need to have a number involved. So you want to make sure that your goal is a SMART goal. You need a number. So your goal should say, by the end of December, I want to run a 6-minute mile. Don't just say you want to run faster. The next question asks: why is body composition a good tool to use while assessing fitness level in an individual? We discussed that earlier, so rewind if you need the answer to that one. And lastly, the question states: your cousin has asked you to help him or her with creating a fitness plan. They want to sign into the weight room resource but aren't sure what to do in the weight room. They've had PE1 and are familiar with different lifts and safety requirements. Their personal goal is to lose 10 pounds by the end of the school year. They're also hoping to become more toned and not necessarily build muscular strength. List the ideas you would help them to get them started. Well, you know their goal, you know they want to lose weight. So a good starting point would probably be to take their body composition so they know what their percent fat is. To lose fat, the best thing you need to do is do cardio, so at least 3 to 5 times a week for at least 30 minutes in their target heart rate zone would be vital. So they can get on the treadmill, they can get on the bikes, they can jog around the school, and then just an easy weightlifting program where they're lifting 5 to 6 different lifts, at least 3 sets of 12. So hopefully this starts you off on answering that last question for the physical fitness assessment. Good luck.